In the next 3 minutes, I'm going to show you how to use ClearTriage to document a triage call in your EMR. In our example, a mom has called who is concerned about her son's first case of hives. I talk with the mom, asking about the duration and severity of the hives, listening for other potentially higher risk symptoms, and otherwise using my experience to assess the patient. In this case, I determined that I do want to use the hives protocol. Here is my list of 225 protocols. I can type in the search box to narrow that down and find hives. On the right, I see information about the protocol, including other protocols to consider, and detailed background information such as cause of hives. This helps me to confirm that this is the protocol I want to use. Next, I work my way through the prioritized list of triage questions, using the information Mom has already given me and asking additional questions along the way to rule out more serious problems. Once I arrive at a question I would answer yes to, I select that question. This determines the disposition for the patient, which in this case is home care, since they have hives with no complications. Notice that I can also explore the rationale behind many of the questions. Next, with the care advice available as a reference, I discuss the appropriate advice with the caller, clicking on check boxes as I discuss each item. I make sure to discuss the reasons to call back, the most important advice to cover from both a safety and liability standpoint. I can also select the appropriate medication dosage for the child, and that dosage recommendation is included in the call note. Finally, ClearTriage includes 233 care advice handouts written by Dr. Schmitt at a 6th grade reading level. These handouts can be emailed or texted to the caller in order to reinforce the care advice discussed. For this call, I will send the handout to Mom in a text message. Now that I'm finished triaging the patient with ClearTriage, I'm ready to transfer my call notes into my EMR. I press Copy and then switch from ClearTriage to my EMR. I right-click and choose Paste to insert the call documentation into the same field where I previously typed my call notes. Notice the notes contain my initial assessment, the protocol used, the positive triage question, and the care advice discussed. That's how easy it is to use ClearTriage.